Hello, Nick from NK Active here. So on our A to Z journey, we are on E. E is for exercise induced, it's a bit of a wordy one, leg pain. Or AKA, it's given the umbrella term of shin splints. Now, we'll come on to shin splints in a second. Exercise induced leg pain basically means any pain in your leg. Your leg, the bit between your knee and your ankle. Above your leg is your thigh. People give it the umbrella term of shin splints. The issue with the term shin splints, it doesn't actually tell you why you're getting pain in the leg. There are over 100 different reasons why exercising your leg can hurt. Just like the term headache doesn't tell you why your head hurts, it just tells you your head aches. There are some of the more common types of exercise-induced leg pain, some that are far more common than others. Let's run through a few. Let's get my trusty leg out. So, what we have here, we have the tibia, your big long shin bone. So, one of the most common causes is medial tibial stress syndrome, and this is the one that really people call shin splints. What is medial tibial stress syndrome? Medial tibial stress syndrome is stress of the medial, aka the inside aspect of the tibia. It normally occurs in the lower third, and you get what we call diffuse pain and tenderness. So it's pain across an area rather than pinpoint. What you'll find is you can exercise through the pain, but it's a little grumpily afterwards, and it then settles down a few days later. What you can then develop is, if you ignore it, in some people, you can then keep stressing the bone, and then you get a stress fracture. The big difference, two big differences between a medial tibial stress and a stress fracture is if you were to get one finger and poke it, it would hurt a lot with a stress fracture. It wouldn't be diffuse. A stress fracture will also annoy you at night, and you'll exercise, it will hurt, and it will still hurt for days and days and days after. And if you really want to give a good test, try a few hops. It won't like that at all. One of the other common types, we don't actually need this anymore because it's not bony. There is something called chronic exertional compartment syndrome. What that basically means is that around your leg you've got this fascia, this compartment of muscles contained within it, and it means that pressure within that compartment builds up too much and it's a little uncomfortable. So what the symptoms are is that you're going out for a walk or run, it feels like someone's got a great big vice around your leg and it's really uncomfortable, and you get to a point where you're like, oh my god, I can't continue, I have to stop. You stop, give it a minute, the pain goes away. You start exercising again and it comes back, and you continue in that cycle of pain, no pain, pain, no pain. You won't get any issues at night. Now, there's a bit of contention around the term chronic exertional compartment syndrome in the medical world, because is it true chronic compartment syndrome? Because technically that requires a surgical treatment. However, there was a sports med doc called Dr. Andy Franklin Miller, done lots of work in the military, and come up with this term biomechanical overload syndrome. In a nutshell, biomechanical overload syndrome gets better with conservative treatment. Compartment syndrome tends to maybe need surgery, but the symptoms are exactly the same. So as general members of the public, it doesn't really matter because the presentation is the same, so don't get hung up on the diagnosis. So there we have it. Exercise-induced leg pain. We don't call it shin splint because it's an umbrella term, and we've got some of the most common causes of exercise-induced leg pain. Hope that is helpful. We shall see you on the next letter.